Good afternoon, and welcome to the Virginia Interfaith Center for Public Policy's live weekly broadcast. I'm Roberta Oster, the Communications Director. Our weekly program brings the expertise and perspective of Virginia's faith leaders, legislators, policy experts, and community activists. We focus on economic, racial, social, and environmental justice issues. And we share resources and opportunities for you to get involved in our work advancing social justice and helping our neighbors. Our program keeps you up to date and keeps our elected officials accountable. This is an interactive broadcast, and we encourage you to please ask questions by writing them in on Facebook during the show. Today, we have brought together state and national experts to address the critical issue of worker health and safety. I am pleased to introduce our guests. Debbie Berkowitz is the Worker Health and Safety Program Director for the National Employment Law Project. Rebecca Reindel is the Safety and Health Director of the AFL-CIO. Jason Yarashes is a lead attorney at the Legal Aid Justice Center. And today we have a special guest, our first journalist to join the broadcast live, reporter Michael Pope from Virginia Public Radio. And now I'm pleased to hand this off to our moderator, my colleague and friend, Kim Bobo, Executive Director of the Virginia Interfaith Center. Kim?
Thank you, Roberta, and thank you to our guests for joining us to talk about this really critical issue of how are we going to protect workers in Virginia and the opportunity that we have in Virginia to create a standard for health and safety. So I want to start by asking Jason, how did we get to this point where we have a possible standard being considered?
Let's see. It's a long story, but in short, really what this the foundation of this is that the community started to speak up. We're talking about workers, coalition partners, community leaders, and really folks that were just interested in what was going on during COVID in the workplace. In short, we had folks both in the Eastern Shore as well as in the Shenandoah Valley, organizers, workers across multiracial, socioeconomic, all the folks coming in the community and saying, hey, look, things are not going right in the workplace here. And they had car rallies in front of poultry plants and came out and said, look, things are not going right. We worked alongside them when we petitioned the governor, who wrote up along with the Department of Labor and Industries, asked their board to promulgate these regulations. And so we really commend the governor and the Department of Labor and Industries for getting to the point where we are. And we're hopeful that the board makes the right decision to enact these important emergency standards.
So, Michael, I'm going to ask you as a reporter, you're new to this. What do you want to know about this proposed standard? Unmute yourself there, Michael.
I am new to this. Thank you. Well, I think, a good place to start would be kind of where we're at right now. So these are proposals. They're not enacted yet. And so there is a feeling in the business community that there should be more input and perhaps some sort of public hearing. Jason, maybe I'll throw it to you in terms of like what's wrong with having a public hearing? Why is there such a rush to go ahead and do this now and not give businesses and the business community an opportunity to weigh in on all these things?
It's a great question. I'll let my colleagues answer or fill in anything. But what I'll say is the public has had an opportunity to comment. And we do have different procedures under Virginia law whereby there's longer comment periods under certain parts of the Administrative Act. And then there's also, for a very good reason, the ability for the government to be able to say, hey, look, there's emergent circumstances here. There was an emergency live or comment period where the public had a 10-day period to do so. There was over 3,000 comments submitted, including comments by large swaths of folks across many different industries for which the board has had time to consider those. And so we would say under these emergent circumstances, it's great. The public has had a time to comment. And as we'll get into later, the board has already determined that this is a grave danger. And so let's push it forward.
Good. So Debbie, you used to work for Osha. You were like chief of staff and key policy person. So doesn't Osha have some sort of standards, and isn't that enough? Why do we need this in Virginia?
So it's quite stunning, Kim, and that is that federal Osha in this administration has decided not to issue any specific worker protection mandates that employers have to follow in the workplace in any state in the country. There are no specific requirements on how to protect workers from COVID-19. There are no requirements that you need to allow workers to wash their hands repeatedly or stay 6 feet apart, or that in some workplaces you need masks, and like in healthcare, you need respirators. Even though they were petitioned to issue an emergency standard, the AFL-CIO did the petition, but OSHA, under Secretary of Labor Eugene Scalia, decided that we're not going to issue any protections. And so therefore, it is really up to the states to implement protections so that workers know when they go to work every day that their employer is required to mitigate the spread of COVID-19 at work. Now, some governors have done this through executive orders where there's no comments, nothing. They just have implemented some requirements, because otherwise there would be none. And so I think what Virginia did by writing a comprehensive proposal and allowing the public to comment on it and to put it in an emergency basis is more than most states have done at all, and is really what the federal government should have done. And bravo to Virginia for moving forward.
So, Mike, I think you want to follow up.
Yes, Rebecca, I was interested in asking you about these complaints to OSHA. So there have been thousands of complaints. The number I saw was 4,000 complaints to OSHA, but only one citation. I was interested in asking you about the process there. I was speaking to an opponent of this earlier today who said that, shouldn't the goal here be compliance rather than punishment? And just because there's one citation, what does that actually mean? So these complaints, some of them are probably from the business community. Some of these are probably frivolous, or people who don't like their employer and are filing a complaint out of revenge or spite. So what does it say to you that there have been 4,000 complaints but only one citation?
Sure. Thanks for that question. Really, OSHA complaints, the fact that you're seeing so many OSHA complaints right now is really a sign of workers being fed up and scared and going to work and knowing that the conditions that they're working in are not safe. And so they're filing complaints. I don't think it speaks to the agency, OSHA, taking any proactive action. And I guess my question would be in response, compliance, this speaks to compliance. Compliance with what? There's no standard to know that there's compliance. There's no real accountability there to know that the prevention measures that employers are putting in are actually protecting people. And that's what a standard would do. A standard would line that up. The fact that there's been one citation and over 5,000 complaints that have been filed, I think really speaks to, what is the lack of accountability. And I want to point out the citation was for failing to report a hospitalization. So while that's really important, that's not a prevention measure. And what people need right now are prevention measures to keep them safe at work.
And Debbie, I want to ask you, doesn't CDC have some guidelines? Isn't that enough?
That's a good question, Kim. CDC has issued guidelines, so has federal OSHA. But these are guidelines. They are advisory. They are not required. In fact, most of CDC guidelines, like everything they recommend, says, if possible, consider this. But they're also just guidelines. They're advisory. OSHA isn't enforcing it, and they're sort of unenforceable. And employers can choose to follow them or ignore them. And, so you're in a state now, a situation where workers are on their own, and you're expecting employers to do voluntary compliance, but there's no greater evidence that voluntary compliance isn't working by the incredible outbreak in poultry and meatpacking plants and nursing homes, that because, companies and industries did not implement this safe practices early on, you have this outbreak. And that's why you need mandates. And I have to say, I know you didn't ask, but the Virginia Emergency Temporary Standard is just basic, requirements. These aren't like fancy pants. You have to put in some kind of new ventilation system, or this is just sort of the basic things that you and I, who are teleworking at home, the kind of protections that we do for ourselves, that employers need to do for workers when they go to work.
So just describe briefly.
So I was curious about following up on that. So you say they're basic, and they're things like sanitation and disinfection and hand washing and physical distancing. But the concern you hear from the business community is one size fits all is a problem. And so if you look at something like welding or construction, it would be really impossible to keep 6 feet apart. So the people involved, these business owners feel like there are lots of jobs where if you try to impose the same standard on them that you impose on everybody else, it's just not going to work. And so what would you say to a business owner who, like the dentists have been opposed to this, health workers, or they want exemptions? What would you say to all these businesses that say this one-size-fits-all approach is not going to work and I want an exemption for my industry?
Michael, we know how to protect the public from COVID-19, and it's 6 feet apart, and it's giving masks and allowing workers to who can't be 6 feet apart all the time. So, there's construction going on right, near my house, and it's all outside. And even when it's inside, they're keeping 6 feet apart. And when they're not, they're wearing masks, and then they're separating. So as opposed to meatpacking plants where workers are still working shoulder to shoulder, hundreds, thousands in a workplace, that's not going to protect workers. And I just want to tell you something about the dentists who have a history of opposing any regulation. And I'm old enough to know that back in 1992, when Osha issued a regulation to protect dentists and dental aides from getting AIDS or HIV at work, they opposed it. They actually completely challenged the standard and lost because they didn't want to wear gloves. They didn't want to wear masks. And I have to tell you, there isn't one dentist office in this country now that doesn't comply with that standard. So I understand people are anti-regulation, but we need to protect one another. That's what we have to do in COVID-19. And if you're an employer, you have to protect your workers, and that's your obligation.
So, Jason, let me ask you, there are differences in the standard, right, for different kinds of businesses? There are like 3 levels. Can you talk a little bit about that?
Sure, I'll give a brief overview of it, and I think Rebecca's probably in the best position to dig in on the specifics. But yes, there are parts of the proposed emergency standards that speak to the low level, mid level, and high level of risk that already have been written into the standards. Again, that were pursuant to what the government proposed in the briefing package, and on which the business community as well as the public has had an opportunity to comment on, and which will be considered by the board. Rebecca, I don't know if you have any other specifics on that you want to go in on.
Yeah, thanks so much, Jason. This standard is set up in a way that is adaptable and flexible and can be tailored to each workplace. So something like a meat processing facility and a dentist office and a small business office workers, it's not going to be applied the same across the board. And that's really the big benefit of a standard that's set up like this. We've seen other standards that have set up like this, and it makes a lot of sense. I mean, in no way does this standard lay out anything, like Debbie was saying, out of the ordinary, really basic protections, but it also tailors it to each workplace. The whole point is for employers to be required to set up a plan. Everybody who is working during a pandemic should have a COVID-19 safety plan to keep them safe. And this, in Virginia, you saw essential workers who had to go to work for those first couple months, and these essential workplaces, really big problems, really major outbreaks. These affect our communities. They don't keep our families safe. They don't keep our community safe. And now with everybody returning to work and reopening, and this certainly is not a one-size-fits-all solution, and this standard is not a one-size-fits-all approach. I mean, this is a very flexible approach, and I think that's the beauty of how the standard is really laid out.
So, Jason, tell us about this Virginia Safety and Health Codes Board. Who's on it? Where did it come from? What is it?
Yeah, so it is. It's built into the law. It basically when the Department of Labor Industries or the Virginia Occupational Safety and Health has something that they want to propose, these go in front of the Health and Safety Codes Board. They've rarely enacted the emergency provisions, and which will come up in a time like this where they've already determined it's a grave danger. The board is comprised of folks both on the labor industry, on the labor side, as well as the employer side, and has 2 representatives from the government, the Department of Environmental Quality, as well as on the Virginia Department of Health. So it's a wide swath of folks that are involved and will have opportunities to vote here. And again, they have already voted 9-3, saying that this is a grave danger to the community right now. We can't hear you, Kim.
Oh, Michael, do you have other questions?
Yes, I've got a notebook full of questions, Kim. So let me ask an open question to anyone who wants to address it, which is one of the chief concerns of the business community is liability. They're afraid they're going to get sued, and then workers' compensation, that they'll have to pay a lot of money in lawsuits and workers' compensation. And one of the things they're most worried about is that there's going to be potentially an assumption that a worker got COVID-19 while sort of on the workplace. But, sometimes we don't know where they got it. And so what they're concerned is the inspector's going to come in. They're going to say, okay, you got COVID-19. You got it here at the workplace, when it's possible they might have not gotten it there. And then the business will be open to being sued and workers' compensation. So what would you say to these businesses who are concerned about the assumption that the worker got the disease in the workplace when that might not in fact be the case?
I'm happy to go forward.
Question to anyone who wants to take it.
I'm happy to go forward. And first I want to say, Michael, to your earlier question, there are grades of protections that employers have to put into this standard based on risk. And so for lower risk, there's just sort of basic education informing people. So it's as you go up in risk that different protections get implemented in the standard. So it's not one size fits all. But so I have to tell you, because I've been doing a lot of work about workers getting sick at work, and I know there's about 2,000 workers' comp claims I think have been filed in Virginia. As a whole, it is very, very hard for workers to get workers' comp when they have an occupational illness for exactly the reason you're saying, and that is the bar is very high to show that it occurred at work. And workers' comp actually limits an employer's liability. It is, in 99.9% of cases, the exclusive remedy that workers have when they get sick because of work. It's not like they can sue the employer, because even if the employer was negligent, the employee, all they have is workers' comp. And the way it works in Virginia, as in 49 other states, is employers purchase insurance. And then the insurance company, handles the claim. And I know in some states, they are passing some laws to make it easier for certain workers to get workers' comp, like healthcare workers and the highest workers, so they don't have to argue that they got it at work. In other states, they're saying that an employer's premium should not be affected by how many COVID cases they have at work. And so therefore it's just paid from insurance. I do know the workers' comp system is healthy, that employers, even if they have cases of workers' comp, their premiums should not go up, because there's such a reduction in traditional workers' comp claims right now that we just actually heard from the National Council of Compensation Insurers that the system is healthy. But I want to tell you, Michael, that I think it's going to be very, very hard for most workers to get workers' comp. And that just means the system of providing, support to workers in terms of healthcare and wage replacement, because they're out because of COVID-19, and most of them in the essential industries that got it at work, most likely got it at work, will now have to fall back on their community and family for support. So in many ways, workers' comp is the best alternative for workers once they're sick, and I hope employers do not contest these cases, and insurance companies should not raise premiums.
Can I just add to that?
Yes, of course.
Great. So under the laws in this country, the occupational safety and health laws, so employers are always responsible for keeping the workplace free from hazards. This is not new. In Virginia, that's certainly the case, right? Virginia has its own agency on occupational safety and health, and that's what this board is pushing to move forward standards under. It's the employer's responsibility to mitigate the hazards that are in the workplace. So we're not asking them to go throughout all the entire community to do so. And it's not the first time that hazards have crossed over between the workplace and the community. I mean, you can think about other hazards where that's happened. Certainly in the case of this virus, they interact very closely with each other. But whether somebody got it at work or not, it is still the employer's responsibility to correct hazards in their workplace so that people don't acquire the virus at work. That is, that's the bottom line, and that's what the agency under the state has been tasked to do with, and I believe that the board is following through with that.
Can I just give one brief? Oh, go ahead, Michael.
Go ahead, Michael.
I'll say on that last issue, if we could go back to Rebecca. So you were saying that, proving, if you prove that someone got it at the workplace, then it's really the employer's responsibility. That's sort of a new phenomenon, right? So, I mean, if you think about the history of this, these kinds of investigations and sort of holding employers responsible in the past, we would not have held an employer responsible if someone got flu, right, or any other kind of viral disease in the workplace. And so this would be kind of a new phenomenon, right?
Debbie, both Rebecca and Debbie want to answer this.
Oh, no, it's okay. So this is not the first workplace safety and health phenomenon. I mean, you can think about things like hearing loss, where this has been argued. It's like, did they get it at work, or did work?
I was talking about viral diseases.
Sorry, viral. Yeah, but this is a wildly contagious disease, right? I mean, this has been, this is new in terms of the impact and the spread, but that makes it even more important to control it where the major outbreak centers occur, and the major outbreak centers have been in the workplace. So in those terms, it's not, and we're not saying they have to be employers have to be responsible for everything, but if you're going to prevent the spread of this virus, you're going to make sure that you're tracking cases and the local health department knows about them, and that they can, intervene, and that there can be preventative standards in place, which is what we're doing here. There are a whole variety of measures at play. So in that term, I mean, we haven't had a disease. This is a pandemic. I mean, right? We haven't experienced this. It is something that really needs devoted attention to prevent the spread, and that's where you're going to get it.
Yes, Debbie.
I want to add something, Michael, if that's okay. So in this pandemic, workers were required to go to work in critical industries. If they stayed home, they didn't get anything. They couldn't even get unemployment insurance. So we have required workers to go to work during this pandemic. We required healthcare workers, we required meat packers, we required supermarket workers. And that's why people are calling them heroes because they really, kept us fed and kept us healthy. And so I think that makes it really different than the flu, and it makes it really different than the cold, where workers can stay home. Remember that. And also, there are a lot of workers now that are too scared to go to work, like in restaurants. And, like in Virginia, there was just a news story that, Virginia has terminated unemployment insurance benefits for a lot of workers, thousands of them that just don't want to go back to work. Now, it could be they don't want to get back to work because it's on reduced hours and they don't have childcare, which are very legitimate. But we're in a really different situation than we ever were with the flu or the common cold. And also, I want to make one other point, and that is that Black and brown workers are essential workers, and they're the ones that have been out front, and they're mostly that make up a lot of the low wage jobs like restaurants, where you're going to have, again, congregates, people that can't telework. And we know from CDC and we know from the Kaiser Family Foundation that because of, various things from structural racism, that, Black and brown workers are impacted in a much more severe way when they get these illnesses because of underlying health conditions, because of lack of access to better health care. And so I think that's what makes this a very different situation. And as Rebecca said, employers have an obligation to protect workers at work, and this is definitely, if you look at the spread in warehouses and meat plants and grocery stores, this is definitely spreading at work and then back out into the community. And if you're going to protect the public, you need to protect the spread, workers from the spread at work.
One of our questioners asked, well, what are the kinds of industries in the medium and high risk categories? Rebecca, you want to take that one?
So there are different ways that you can look at this, but when you're thinking about when you know that you're going to be in contact with somebody who has COVID, so for healthcare workers, it's obviously, I think many people watching understand and saw that the first couple of months of this pandemic, healthcare workers were extremely high risk. They're taking care of the patients who have the disease. There are other workers associated with healthcare workers like transport, first response, all very at high risk. But and it's important to remember, it's not only where workers know that they're taking care of a patient with COVID, but this disease, many people don't present with symptoms. So it's also a lot of other workplaces where workers work very close to each other, or they work with the public. So Debbie mentioned like poultry processing. That's a pretty high risk environment for this, and other plants, manufacturing plants where people work closely together, where they don't have these other measures that are in place. So you have different risk levels. I mean, that's going to be different than, like I said earlier, maybe some office workers. Those would not necessarily be in the highest risk category, but there would be other measures that they would have to implement in those scenarios as well.
Great. So what can people do about this?
Who wants to go? So, there are really tried and true measures for preventing workplace safety hazards. I mean, we've been doing this for centuries, for decades, surely. The Occupational Safety and Health Administration, everybody knows by now, OSHA, it was created in the 70s, and we know how to prevent workplace safety and health hazards. And you can approach this in a similar way you do for other safety hazards. So I know a lot of people know about PPE now because that's been all over the news, people wearing protections, but there are a lot of other ways, like keeping workers farther apart from each other in terms of, Debbie mentioned the 6 foot or more rule and certain access to, sanitation and putting up barriers and not having people work closely together. That might mean staggered shifts. That might mean physical isolation for when folks are near each other. There's a host of things that are not new, right? We've done this for exposure to chemicals and dust and other things. I mean, we've done this in other capacities. It's just adapting it to it being a virus spreading in the workplace.
I've got one more.
Go ahead, Jason.
Just very briefly. So in terms of actual action items, folks can reach out to the governor, administrative agencies, the folks that we've talked about, to really encourage people to make the right decision, as well as board members who are across different communities across Virginia or representing different sectors. So those are actual action items. And I would also, in terms of the messaging, we've talked about a lot of different messaging, but Michael brought up some great points about that are on the opposing side about increased liability, overregulation. And what I would sort of say to that is to try to flip the narrative here, which is that really what we're not interested in increasing liability for folks. We're not interested in putting businesses out. In fact, quite the opposite. We want businesses flourishing as they have in Virginia. Virginia is the #1 protective state for businesses, but that should not be at the expense of workers, particularly during emergent time. Virginia's historically been almost last in terms of worker protections. So we need to flip that narrative. When we have good, healthy workforce and people are happy and feel empowered to be able to speak out, that helps business. And frankly, if other businesses are not complying with the standards, then other businesses are being put at a competitive disadvantage. When other businesses are not complying, just like any other law, they're putting not only the individuals at risk, as well as the public health, but also their own business when other businesses are sneaking under the radar by not complying.
Jason?
Well, and I have to say, I run a small business, right? I run a small nonprofit, and I don't know what to do, right? This is a scary time. And so, frankly, I would love some just very clear standards that say, here's what you should do, Kim, right? And if you're doing this, you have the best chance of protecting your workers. And I think most employers want to do the right thing. They want to protect their employees. But, I don't have a degree in this. And so it would be helpful to most employers, especially small employers, to have some clear standards on how you can protect your workers. Michael, it looked like you had another question there, and then we're going to probably just take a couple more questions and a few more comments, and then we'll need to wrap up. Go ahead, Michael.
Yes, thank you. So, Jason, you just said something I was interested in circling back around on, which is, Virginia has this reputation of being first in business. Another reputation that Virginia has is not really ever being the first to do anything. Virginia is sort of one of these states that follows along the lead of other states and let them make mistakes and then come around and do it, the Virginia way. So, Virginia does not have the reputation of being the first and doing the stuff first, but this is a first, right? There is no other state that has done anything quite like that, quite like this. And so what would you say to businesses who are really concerned about leading the way in a way that might have a bunch of mistakes and might do something that's actually harmful to businesses, creating red tape, costing a lot of money during an economic crisis? I mean, there's clearly a lot of concern in the business community. What would you say to those businesses?
Now, I kind of harken back on what I had discussed before, just that really we're talking about really common sense regulations here. And as Debbie and Rebecca have noted, nothing here is really out of the ordinary. We're talking about what not only the CDC, but medical professionals are talking about across the country, the things that we need in the workplace. And so kudos to Virginia for being on the front end of that. Sometimes, whether you're a business, whether you're individual, you have to take a step back and do some introspection and realize where you're at on an issue. And Virginia, both the governor and the Department of Labor is taking a step back and saying, hey, if nobody else is stepping up, let's step up to the plate here and really be first on this. And so kudos.
And I'm going to call on Debbie in a second, but I also want to say, we should all be thanking the governor for calling for this. The governor is a physician. He understands this. And so we're going to put up the governor's email so you can send him an email and thank him for asking his staff to put out these proposed regulations. So Debbie, you want to comment on this?
Yeah, just for a second, I agree. I want to give kudos to Governor Ralph Northam. I think because he's a physician, he gets it. If you want to protect the public, from COVID-19, you also have to make sure that some very basic precautions are being followed in the workplace, because he saw just in his own state what happens when it's not followed. And I also want to say two things. One is that Virginia OSHA, you have to give them credit that, you know, they sat down and they wrote this emergency standard and they put it out for public comment. And in a lot of other states that have their own OSHAs, like Virginia, the governors just implemented executive orders really quickly to get protections in. And so a lot of the states have some of these protections, more here, less here, but none of them did it with any public comment. So I think this is really a great model, a model of democracy and a way to protect Virginia. I mean, if Virginia wants to keep its case rate low and protect the public, this should be what the board adopts, and we hope they do.
Rebecca.
Sure. Just to go back on something that I believe Michael asked, it's not new about how to protect people from infectious diseases in the workplace. California has had a broader infectious disease standard for a long time, and you know, it didn't put people out of business out there. There are just very simple, common sense control measures that they've been able to implement, say in like the healthcare industry. So I just wanted to point out that, you know, this would be the first for COVID-19. It would be incredible, and it would really set the stage. But I think it's not out of the ordinary. It's something really to commend the state for doing. And you know, small businesses have a lot of tools at their disposal. We've heard from a lot of small businesses who want to know, instead of getting a lot of different guidelines out of here, out of there, CDC, OSHA, they're not required. We don't know what to pick out of these. We don't know what we can follow up on. They have a lot of tools, right? They have the ability to follow, they're going to have the requirement to follow the standard, which we've heard would help them. And I think, Kim, that goes to your point as a small business owner. There's also something in OSHA called the consultation program. And this is a program that's free to small businesses. Small and medium-sized businesses can call OSHA anytime. They always have been able to. They can have free consultation in their workplace to help them improve and to comply. I mean, this isn't just about going out and issuing citations, but this is about really getting those preventative measures in so that people don't get sick. And there are a lot of tools at hand to do that.
So, Michael, do you have one last question you want? And then I'm going to also ask each person to close by saying why they think we ought to do this in Virginia. So, Michael, you have a last question for them too?
Sure, yeah. Like I said, I got a notebook full of questions. But you know, one thing that you hear from businesses that they're particularly concerned about is social media. So one of the items here that is being discussed is not allowing businesses to take retribution on people for posting things on social media. Like, for example, if your employer doesn't want you to wear a mask, and then if you go on Facebook and you talk about your employer and how terrible they are and they didn't want you to wear a mask, you know, the concern you hear in the business community is that's not really the best way to go about doing this. Maybe you should file a complaint with OSHA. Maybe you should file a complaint with the state. And sort of going online and airing all of that out in the public square on social media is not the best way to go about doing that. So that particular part of what we're talking about here has raised a lot of concern. Open question, I guess, anyone that wants to talk about that.
I'll make a very brief note. Just up and above the general notion in terms of Virginia and the United States as a place where we enjoy great freedoms in terms of being able to speak. It's very interesting hearing that because we hear a lot of companies pre-COVID that, in fact, some that make workers sign agreements say that if they have any complaints about anything, that they're not going to complain about anything via social media or otherwise. So we have them trying to stymie folks in the first place to be able to speak out about things. But again, we'll go back to this notion. If folks are operating correctly under the standards, they're not going to have any problem. Do the right thing, and we will be correct in having progress here for folks across all industries.
So, Jason, why don't you take this question too from our listener?
affect migrant farm workers? No, in this instance, they are covered by these protections, Manuel, and we can go on a separate session into the fact that farm workers are historically left out of a lot of these protections, but they're actually in these protections. And one interesting part here is a lot of these petitions were given on behalf of migrant farm workers and poultry workers. So it's great to see that the folks that are historically been left out actually have turned the tables here, and we're on the precipice of enacting regulations that are actually going to enacting standards that are going to protect all workers in Virginia.
So let me ask again in closing here. So Rebecca, why should Virginia pass this?
Look, Virginia has major ongoing outbreaks. I mean, they have, Virginia has had outbreaks this has been going on since early March, even before that. And these aren't older outbreaks that we're just trying to address now. Just last week, there were reports of thousands of workers getting sick, many workers dying in different industries. This is just as relevant today as it was then for Virginia workers, for their families, for their communities. And so it's really important that we get this done quickly and that we move the process forward. Workers need to be protected so that their families can be protected.
All right, Debbie.
So in this pandemic, to protect the spread of COVID-19 out in the public, we have to protect workers at work from the spread of COVID-19 at work, where they can then bring it back out to the community. And as the Virginia economy reopens, and we're all rooting for this, we want to make sure that workers who are now being called back to work, that they know that their workplaces have to implement certain measures to protect them. And I think that will protect not only the workers, but their community as well.
Jason.
The arc of worker justice is long, but I would suggest that Virginia is in a good position to be a leader and be on the right side of history here and be a model for other states in the South and across the nation to show that we're not just protecting businesses during this historic pandemic, but we're also protecting the workers that keep all the businesses and the economy afloat.
So I want to thank our guests, but I also especially want to thank Michael Pope for asking the question for reporters. And if anyone listening, particularly reporters, because this issue is coming up for a vote on Monday, if you want to write about this, please call Roberta Oster at Virginia Interfaith Center, our communications person. She can get you in touch with any of us to answer more questions. We urge our listeners to send an email to the governor. We're going to put it up on the screen one more time. And if you want to stay informed on all of these and other important social justice issues, please sign up at virginiainterfaithcenter.org. Again, thank you to the guests. Thank you so much for joining us this afternoon. And thank you to listeners for joining us.